symptoms indicating that our kidneys are not functioning properly? In this video, you will find the answers to these questions. So if you have these symptoms, how can you get rid of them? How can you treat them? Before we start our video, please don't forget to subscribe to our channel. Now, let's get into the details of our video. All right, we will share with you the symptoms indicating that our kidneys are not functioning properly. But first, let's learn why kidney failure occurs. There are many factors that can prevent the kidneys from functioning properly. These include exposure to environmental pollution or toxic drugs, certain acute and chronic illnesses, severe dehydration or dehydration, and kidney obstruction. The cause of kidney failure typically determines the type of kidney failure. The highest likelihood of kidney failure occurs when blood flow to the kidneys suddenly stops. Some conditions that cause a loss of blood flow to the kidneys include a heart attack, heart disease, liver tissue damage, or liver failure, dehydration, severe burns, allergic reactions, and severe infections such as sepsis. Hypertension and anti-inflammatory drugs can also disrupt blood flow. All right. When waste accumulates in the body due to urine not being excreted, toxins overload the kidneys. Some cancer types can lead to this condition by blocking the urinary tract. Among these are the most common types in men: prostate, colon, cervical, and bladder cancers. Kidney stones, enlarged prostate, and blood clots in the urinary tract can damage the nerves that control the bladder and block urination, leading to kidney failure. Other factors causing kidney failure include blood clots in or around the kidneys, infection, toxins derived from heavy metal poisoning, drugs and alcohol, vasculitis, and autoimmune disease that can cause inflammation of many organs in the body. Lupus, an autoimmune disease that can cause inflammation of the capillaries in the kidneys, bacterial infections, and subsequently hemolytic uremic syndrome, a condition characterized by the breakdown of red blood cells, multiple myeloma, a cancer of plasma cells in the bone marrow, dermatomyositis, an autoimmune disease that affects the skin, thrombotic thrombocytopenic purpura, a disorder that causes blood clots in the capillaries, chemotherapy drugs used in the treatment of cancer and some autoimmune diseases, dyes used in some imaging tests, and uncontrolled diabetes, among other factors. Now let's move on to the symptoms that indicate our kidneys are not functioning properly. If you have these symptoms, your kidneys are not functioning properly, and you may face serious problems in the future. So what are they? Difficulty sleeping. When your kidneys are not functioning properly, it becomes difficult to fall asleep when toxins are not excreted through urine. People with chronic kidney disease are more prone to sleep apnea. Sleep apnea is a condition that causes one or more pauses in breathing while sleeping. These pauses can last from a few seconds to a minute. Continuous heavy snoring indicates the need to see a doctor. All right, another sign that our kidneys are not functioning properly is headache, fatigue, and general weakness. Healthy and properly functioning kidneys produce a hormone that helps protect strong bones by converting vitamin D in the body and controlling the production of red blood cells. This hormone plays an important role in the production of red blood cells. When the kidneys are not functioning properly, they produce less erythropoietin. The decrease in red blood cells leads to rapid fatigue of the muscles and brain for oxygen carriers. Anemia is observed in people with chronic kidney disease. Anemia can start developing in 20 to 50% of normal kidney function. If you are getting enough rest and sleep but still feel tired, low energy levels, and general weakness, it is essential to see a doctor without delay. All right, another sign that your kidneys are not functioning properly is having dry and itchy skin. Healthy kidneys do amazing things by filtering waste and extra fluids from the blood to maintain the proper balance of minerals in our bodies. It signals a failure to maintain the correct balance of minerals and nutrients that can lead to kidney and bone disease. If you have dry and itchy skin, try to consume more fluids. Consult your doctor before taking any medication for itching, as some medications contain potentially harmful substances that can damage kidney function. Another reason: bad breath and a metallic taste in the mouth. When waste accumulates in the blood, the taste of food changes and leaves a metallic taste in your mouth. Bad breath indicates another sign of contamination and toxins in the bloodstream. A metallic taste in the mouth can result from an abnormality in taste due to various reasons. This taste abnormality can result from side effects of medications, various diseases, or environmental factors. If you have a taste disorder in your mouth, treating the underlying cause will restore the metallic taste. Another sign that your kidneys are not functioning properly is shortness of breath. When the kidneys are not functioning properly, extra fluid enters the lungs. Anemia leaves your body oxygen deprived, resulting in shortness of breath. Shortness of breath can be experienced due to kidney failure, asthma, lung cancer, or heart failure. If you are struggling to breathe, you should consult a doctor immediately. Another factor that could lead to kidney disease is swelling in the ankles, feet, and hands. When the kidneys are not functioning properly, they cannot excrete extra fluids from the body. This causes swelling in the lower parts of your body. Swelling of the lower body indicates problems with the heart, liver diseases, and vascular problems in the legs. Sometimes taking medication, reducing salt, and taking excessive fluids can prevent swelling. If it doesn't help, you need separate treatment. Back pain. Kidney failure usually occurs deep and causes back pain immediately below the right rib cage. These pains are felt in the groin or hip areas. Back pain due to kidney failure is accompanied by vomiting, fever, and frequent urination, which are common problems. Normal back pain is more local. It occurs suddenly and there is no fever. If you experience back pain and pain relievers are ineffective, do not neglect to see your doctor. Another sign of kidney disease is swollen eyes. Swelling around the eyes can be explained by the kidneys leaking a large amount of protein into the urine and distributing it throughout the body. If you have enough protein in your body and have rested enough, but still feel swelling around your eyes, don't forget to make an appointment with your doctor. High blood pressure. Your circulatory system and kidneys are interconnected. The kidneys have small nephrons that filter waste and extra fluids from the bloodstream. If blood vessels are damaged, the nephrons that filter your blood do not receive enough oxygen and nourishment. Therefore, high blood pressure occurs as the leading cause of kidney failure and the second cause. Consume folate-rich foods that produce red blood cells and prevent anemia, and learn to manage your high blood pressure. The last symptom is changes in urine. Healthy kidneys filter the bloodstream to produce urine. However, when the filter is damaged, blood cells begin to burst into the urine. Your kidneys are responsible for producing urine and excreting waste. Changes in urine frequency, odor, color, and appearance should be considered. If there are bubbles in the urine, it indicates the presence of unwanted proteins in the urine. If you experience such complaints, see a doctor immediately. If you think our video is helpful, please don't forget to like, share, and subscribe to our channel. We wish you all a healthy life. Goodbye.